Thank you, Lynn, and thank you for the opportunity on behalf of my colleagues at the Palo Alto Medical Foundation and the Palo Alto Medical Foundation Research Institute to share with you our experience building a culture that promotes shared decision-making. I'd like to start with an overview of the Palo Alto Medical Foundation and partners in what we call the Partners in Medical Decision-Making program, and then move to promoting how we promoted awareness of our program to physicians and to patients, and then end with some lessons learned. So the Palo Alto Medical Foundation is a multi-specialty medical group in the San Francisco Bay Area, consisting of over 750 physicians and serving more than 750,000 patients, mostly in a fee-for-service model. I tell you this just to sort of set the stage for what I'm going to say. Being in the heart of Silicon Valley, PAMF has been an early adopter of such things as the electronic medical record and the online patient portal, as well as having a commitment to patient education through community health, supporting community health education centers and shared medical appointments. What I'll speak to you about today is an initiative that was funded by the Informed Medical Decisions Foundation, which is the Partners in Medical Decision-Making program, which is a demonstration program designed to implement decision aids into primary care practices. So what's the problem? The problem is that the use of decision aids is not common in current practice. And here I have some quotes here, one by a patient who says, "It would have been nice had it been offered during my visits to the sports doctor, the primary care doctor, the orthopedic doctor." He's been to several doctors, and he says, "None of these people offered me this decision aid." But on the other side, we have physicians saying that their patients don't really want the decision aid, because if I offer it, they won't want to think, because they don't want to think about something like colon cancer screening, or you just kind of run out of time. So what do we do? What do we need to do? We needed to promote awareness to facilitate a cultural change. And who are we trying to engage? Obviously, we're trying to engage everyone, from physicians to patients to institutional leadership. And so what we did was we made a strategic decision to develop a social marketing campaign to increase awareness of shared decision-making and decision aids. And social marketing in this context in health has to do with promoting a health idea. And so that's what we wanted to do, a concept. And as you all know, when you market in marketing and when you promote an idea, branding is really important. So one of the first things we did was we actually named our program, Partners in Medical Decision Making, and in it we wanted to reflect our goal, which was to promote physician-patient partnership and to empower patients. So we then came up with these 3 taglines: empowering patients to make personalized decisions with their healthcare team, prescription strength information for better decisions, and better decisions together. And these are the taglines that are on anything that we produce, whether it's educational material, whether it's branded products, as you can see here, our newsletters, so that patients and physicians and whoever's reading this are reminded that this is what Partners in Medical Decision Making is about. We also engage practitioners and leadership through various and many channels, and you see an example of some of those here, including grand rounds, newsletters, sort of more traditional things. But I think I wanted to draw your attention here to academic detailing. And you might be familiar with academic detailing from the pharmaceutical industry, where the pharmaceutical representative comes to the physician's office, talks to them about their product, and educates them and tries to sell them on their product, basically. We took this idea and instituted the same principles. Our wonderful shared decision-making navigator, Caroline, would go and do visits to each clinic every other week, talk to the physicians, talk to the nurses, medical assistants, whoever was involved with the decision aids, just to remind them that the decision aids were there, but also to train them on how to use the decision aids, and just to get feedback on the program. And this was a tremendous time investment, but really was necessary to keep the visibility of our program high in the clinics. We simultaneously promoted decision aids to patients in the form of posters and brochures in the exam rooms, and then PAMF, again, being very IT savvy, has Facebook, Twitter, blogs, newsletters, and the like, so we got mentions in there. And then we directly engage patients through two mechanisms, which I'll briefly mention. One is the self-screening survey, and the other is shared medical appointments. So the brief survey was a survey at check-in when the patient checked in to the clinic to assess the need for a colon cancer screening decision aid. So we had a series of questions that asked, are you over 50? Have you had colon cancer screening? And if the patient was eligible and expressed interest in receiving the decision aid, the medical assistant or the front desk staff would give the patient a decision aid prior to seeing the physician. And really, this was very successful. You can see before the screener, the clinic was passing out about 4 decision aids per week. During the time that the screener was in use, decision aid distribution went up to about 18 to 20 per week, and then all of a sudden it dropped off again, and we were wondering why. So we went back to the clinics, and what we found out was that the physicians actually, although they initially gave their approval, they withdrew it. For example, physicians said, we don't want to continue the self-screener because the volume of patients who are interested in materials is difficult to manage. In other words, they didn't like having to talk about colon cancer screening when it wasn't on their agenda. Or another physician said, if we give the decision aid to patients, we won't be providing personalized care, which was sort of interesting because that's exactly what the decision aid is designed to do. So even though we were successful in engaging the patients, what we found was if the patients and the physicians, if the incentives aren't aligned and they aren't on the same page, we really were not going to be successful distributing the decision aid. And this was a theme that was prevalent throughout our in-clinic distribution. And you can see here just briefly, this is from our health affairs paper, that this red line represents the percentage of patients for colon cancer screening that we feel like we reached, and that number by and large was under 10% of eligible patients. So even though we distributed over 6,000 decision aids in this project, we think we reached less than 10% of patients. So there's a lot of work still to be done. A more successful intervention is what we call the shared medical appointments. For those of you who don't know, shared medical appointments are when a group of patients, instead of with the same condition, see a physician together. Instead of having individual appointments, they come together and they discuss their condition. And early on in our project, our steering committee said, I think that shared medical appointments would be a great way to institute shared decision making and engage patients and try to distribute decision aids. So we solicited interest from our geriatricians who were interested in doing shared medical appointments, and we set up a series of 3 90-minute sessions whose goal is to engage patients in care and perform functional assessments for conditions that have a high impact on health outcomes and aren't consistently done in primary care. Things like memory assessments, fall assessments, screening for depression. So really this is a way to both achieve the physician's agenda and engage patients. And because individual assessments are made and documentation is done in the electronic health record, it can be billed as a standard level 3 visit. So all of these are billed at a 99213 level. We've enrolled over 150 patients to date on a variety of ages. And actually, I'm going to let this, we have a video that was produced by PAMF Public Affairs. I'm just going to show you a little bit to let you experience the shared medical appointment.
On Thursday afternoons, you will find a group of like-minded seniors ages 65 and older on our Palo Alto campus. They have all signed up for the Mind, Body, and Soul shared medical appointments in successful aging. Successful aging does not happen spontaneously. Having success on one's aging journey boils down to not leaving things to chance. That's why being proactive and having the willingness to adapt are so important. We believe that seniors need to know where they stand on their journey, and they need a roadmap for the future. Many people rightfully wonder, how am I doing? What am I doing well? And what more can I do to age successfully?
When you sign up for Mind, Body, and Soul, you're joined by a doctor, our nurses, and also fellow travelers on the aging journey. Rather than 15 minutes that one might get with a traditional doctor's visit, we devote 90 minutes to each of these appointments. During the appointments, everyone gets individualized assessments and also a focused medical exam. We listen to each other's background history and also take some time to check out some of the most common concerns in aging. For session 1 of Mind, Body, and Soul, we examine the effect of aging on your brain function and memory. We share tips on how to best enhance your brain capacity, and we also discuss what types of additional tests or treatments might be helpful. For the second session, we help you figure out your potential risk for falling down. We examine the day-to-day impacts of injuries from falls and also share tips to proactively reduce your chance for future falls. Finally, everyone gets together to reflect on the emotions and the challenges of aging. We really want you to come away from these appointments feeling empowered and feeling like you can enjoy the aging journey to its fullest extent.
Thanks. So that just gives you a little bit of a sense of what happens at a shared medical appointment and the goals of it. So just to finish up quickly, what we found from our experience is that culture change is very hard. And that engagement at all levels of the healthcare system is really required, from the patients up to the leadership, because it doesn't happen otherwise. Physicians may need more training, team-based models where physicians aren't the only people involved or work best, and then incentives need to be aligned, as I mentioned earlier. And patients need encouragement to become engaged. And then, as we showed with our shared medical appointment, models of care such as these might be more conducive to shared decision-making and patient engagement. So I thank you for your attention. I just wanted to acknowledge our funders, the Informed Medical Decisions Foundation, the PAMF leadership physician staff, and our fantastic PIMDIM team, of which Dominic mentioned he and I led this project before he left, sadly, to go to the Gordon Betty Moore Foundation. Thank you.